Hello everybody, my name is Katie, welcome back to my channel. So for today's video, I am doing something that's more geared towards pharmacy students, or I guess just medical students in general. I think this advice could apply, but specifically I'm going to be speaking from my pharmacy school experience. So I'm going to be talking about advice that I have for APPEs, which are our clinical rotations, either your third or fourth year of pharmacy school, depending on which school you go to. So I'm gonna be giving you my top 10. I wrote these down on a list. It's on the computer behind the camera. So apologies if it doesn't look like I'm looking directly at you. It's because I'm referring to my list, so I make sure I get all of my bullet points that I want. So that's pretty much all I have for the intro. Let's just go ahead and get started. So my number one tip, and I'm sure that your regional coordinator or whoever is like monitoring your APPEs will let you know of this, but I think this is such a good a piece of advice that I just feel like I need to say it. It's to email your preceptor 2 weeks before the start of your rotation. This is very important just to introduce yourself, basically inquire about those first day instructions and any guidelines or resources that they would recommend that you look at before you come in. I can go ahead and on the screen, I'll put a sample of one of my emails. I'll block out all the information, but I'll put a sample just so you can get an idea of what I'm talking about. But basically, this will show that you're very proactive, you're excited about the rotation, and you're ready to learn. I also think it'll make a really good first impression to your preceptors, because pharmacy is such a small world. I've been told this so many times, and honestly, I see it. Pharmacy is a very small world, and people talk. So if you make a good first impression, it will just set the bar nice and high for you, and you'll be ready to go in and rock that rotation. And also, that first impression, very important if you want to do residency and you want to get letters of recommendation from your preceptors. So keep that in mind. But that's pretty much it for my first tip, is to send that email out before the rotation and kind of just be proactive, and you'll be good. So my second tip is to make sure you know where you're going the first day and leave very early. I don't know if that's just me being very anxiety ridden and I don't want to be late. This goes along with making a good first impression. You don't want to be late on the first day. That's not good for anybody. So I actually often drove to my sites the day beforehand, just so that I would get an idea of what the commute is like and kind of understand if there's any tricky turns or exits on the freeway that I need to take, which actually did prove to be useful, because there was one rotation where the exit was so weird. It split off into weird sections, and I was I don't know what I'm doing. It would have just added a lot more to the panic of first day jitters if I didn't do that. So when I was actually going on the first day, I recognized that and I was okay, I know what to do this time. So it just alleviated that little bit of stress that for the first day. So I would highly recommend, if you're able to just make that commute the day before, see what it's like. Also, it's nice to know if what the parking situation is like, because at least for me, for one of my rotations, I was told to park in a specific place, and I was I don't know what this place is. I don't want to circle around the parking lot for forever on the first day trying to find out where that is, and then be overly stressed that I'm gonna be late. So highly recommend. My third tip is that you're not going to know everything, and that's okay. Your preceptors will not expect you to know everything. They do expect that you try your best and that you are learning. This is really important, because I feel after your first 2 or 3 years of pharmacy school, it's okay, you've learned all your didactics, you're going on your rotations now. And I mean, it is true, but you're also not going to know all those clinical pearls and all those details and remember every single little bit of every single lecture, and that's okay. They understand that. When you do have questions, or if anything is confusing, it doesn't make sense to you, make sure you ask questions. Of course at the appropriate times, but it's important to ask questions, because that's what they're there for. They're your preceptors, they're there to teach. Obviously, they decided to be a preceptor because they like to teach. And then you asking these questions, it shows your interest and that you're actually actively thinking about the topic, and that you care. You're trying to learn, which is the main goal of APPEs. It's to actually learn and put your skills in the classroom to use clinically. My fourth tip just has to do with things that I would recommend bringing to your rotation site. So what I brought was a notebook, which is very handy for writing down anything that your preceptor tells you, or any sort of notes or whatever basically anything like assignments, whatever, like you have a notebook there on hand, just like a little pocket-sized notebook. You can get them on Amazon. I find that very helpful, just big enough or like small enough to stick in your white coat pocket. Along with that, like a pen or pencil, obviously, because you need to write. A highlighter I did find useful in some rotations if I'm highlighting like lab values or something, which one of my rotations was like paper-based. We had a lot of paper-based records, so it was helpful for that. A calculator, sometimes you will be needing to do calculations for certain things depending on what rotation you're on. And then obviously a backpack to put all this stuff in. They'll have a place for you to put your bag typically. And then your lunch and water, don't forget those. It's important to stay hydrated and eat your food. You need energy. So as for lunch, at least what I always did is I always packed a sandwich on the first day, just because I was like, I don't know what the food situation is going to be like. Like they should have I feel like everyone does have a microwave, and I feel like it is standard to have one, but just in case, I was like, I don't want to eat cold whatever I was bringing. So I always just brought a sandwich just to be extra safe. And then from there on, like I could buy from the cafeteria or I could bring my microwavable food, whatever. But that's at least what I did. You can do what you want though. My fifth tip is to don't forget what your preceptors have already told you. This is very important because sometimes in the beginning of the rotation, they'll tell you stuff, and then later on in the rotation, maybe a couple weeks later, they'll like ask you again. And it looks very bad on your part if you don't remember. So they're taking the time out of their day to teach and mentor you, and they have busy lives too. So if they do explain something to you, try to remember it the best you can. That's a good thing of what the notebook is for. And that actually leads me to my sixth tip, which is if they ask you a question and you don't know the answer to it, which is fine because that's completely normal, tell them, you're not sure, but that you'll look it up, and then make sure to get back to them within 24 hours. That's very important. You want to show initiative. You don't want to wait for them to bring it back up, because sometimes what they're doing is they're seeing if you remember and you actually bring it back up the next day, rather than them prompting the conversation. So that's really important. And then that's what I use the notebook for. If there was something I didn't know, they asked me and I looked it up at home. I would like write down the question at rotation. At home, I would write down some like bullet points of like the research I did. I would also like write down my sources too, just in case. And then when I go in the next day, like basically when I see them, I would let them know, like, I have the answer for you from the question you asked me yesterday. Whenever you're ready or whenever is an appropriate time for you to discuss it, I'm ready to discuss. So just kind of letting them know and letting them do it on a timeline that's good for them. That's what you should do. Okay. And then number 7, this is really important for if you want to do like residency or even for like job applications. Actually, it probably will prove useful too, but it's to write down any patient interventions that you've done. This is very important. A very popular residency interview question that always comes up in every single residency interview is like, tell me a time about this, or you made an intervention about this, or your favorite intervention, or your most memorable intervention, or whatever. Like, always just write down your interventions that you do. That way you have like a good list to pull from in your brain for when you're doing your interview and you get asked about a certain scenario. You can give a real life example. So write down your interventions. It's very important. My 8th tip is to be professional. It sounds so simple, but so many times I've heard of students being like unprofessional which is, I feel like, one of the easiest things you can do personally. But it's just show up on time, do your work, refer to your preceptor by their preferred title. Some people like Dr. Blank, some people like their first name, and just know that you are a guest in their facility, in their hospital, and they are letting you work at their facility. So just remember that you are a guest. Just be polite. Professionalism is very important. I feel like I need to stress that. And I guess that's pretty much it. Ooh, sorry, I hit the mic. But that's pretty much it for that tip. Number 9, ask for feedback. I think for most programs, there is like integrated feedback built in. There's like a midpoint feedback that you get so that you're able to improve yourself before like the final eval, which is when you get your grade. At least that's how my school did it. Also, I know some schools are like pass and fail for APPEs. Mine was graded. I think that just differs, but ask for feedback regularly. I think that's very important so you know how to kind of just improve yourself and points to focus on for the following weeks. That way it's not only just for the grade, like that way you do become like a better pharmacist or a better clinician, and overall just improve yourself throughout that APPE year. I think that's very important. And then we finally made it to number 10, which this one's kind of a fun one. It's just make friends with your peers. It's always nice to meet others and make connections. On rotations, sometimes you'll be by yourself. I had some rotations where I was by myself. I was the only student there. And then I've had some rotations where I was there with multiple other students from different schools or even the same school, but with different schools. And the fun part about that is you just get to meet new people and talk and make new friends. And connections always prove to be useful. It's always nice to know somebody it's always nice to know somebody who's like going through it with you. So just make friends, be nice. A lot of the times you'll have to like collaborate with each other, which will also be important for like residency interviews, talking about like how you collaborate with each other. So you can use like those instances as examples, but that pretty much concludes my tips for APPEs, my advice, or just clinical rotations in general, I guess. It's stemming from my knowledge of pharmacy school though, but I hope that helps you, and I hope it doesn't scare you for APPEs, because it is scary in the sense that like you're kind of in the real world now. You're, like actually helping to take care of real patients and stuff, but ultimately it's a really fun time, and you learn a lot and you grow a lot. And I feel like that year of APPEs, I actually learned like so much, not so much more, but kind of as in a sense, so much more than I did in didactics. And I think the reason for that is because I'm just like a hands-on person. Like when I do things, when I physically do things, and when I physically see like real life examples, I remember it better. So it's fun. It's a good time. It goes by really quick, so enjoy it. If you do have any like specific questions about APPEs, you can ask me in the comments section below. I'll do my best to answer them to the best of my ability. But that concludes the video. Give it a thumbs up. Subscribe down below. I have more pharmacy videos or more everything videos on my channel, so feel free to check them out if you want. That's it. I'll see you next Sunday for another video. Bye.